Well, I mean, it's 9:59 here on Friday morning. The sun is shining, and on this episode of Talking Business, we've got financial coach, Ramsey certified Nicole Kobziewicz.
Good morning.
And we've got Ashley Hammond. How are you guys doing today?
It's Friday, so pretty great.
Pretty great.
Fun Friday.
So we're going to have a little conversation here. I'm actually going to just back out of this one and let Nicole and Ashley, as they are two financial professionals, have a good conversation today about Medicare benefits and other need-to-know items for anyone out there in the finance world. So welcome to this podcast episode, and here we go.
Awesome. So Ashley, first I want to say that I'm so glad that you're doing what you're doing, because this is it can be confusing for the population that you are, working with, because they're older, it's complex, the terminology, the things can be very overwhelming. And so it's so great to have an agent to help them through this process and carry them through answering all their questions. As someone who works with people in a very comprehensive way in their financial health, insurance, Medicare specifically, comes up later on in our time together. And so I'm so thankful to have people like you to refer to and give them the next resource of help. So super cool. So why don't you tell us a little bit about how long have you been doing this?
Absolutely. So I am actually a new health insurance agent. I got licensed in January of this year. That doesn't mean I'm new to healthcare, though. I actually have worked in healthcare for 17 years. Don't let that fool you. I am not over age 30. So, don't think I'm old. But to be honest, I have, been a healthcare provider for 13 and a half years. Before that, I worked as a nurse. I have worked all over, worked in the hospital setting, in oncology and palliative care. I worked in the emergency room. And then I actually went and I worked in a nursing home for 6-ish years. And now I do in-home care. So a good amount of healthcare experience under my belt.
Awesome. So what made you want to pursue becoming a Medicare health insurance agent?
The truth is, it was burnout, right? The healthcare world has changed since COVID in particular. And honestly, healthcare is a business, right? And, a lot of us healthcare providers got burnt out, especially after the pandemic. And so I was looking for a new way to help people. And I think that being a healthcare agent and making sure that people are properly covered in regard to health insurance and make sure they truly understand their plan is another way that I can serve our population.
Yeah, it's a great way to serve. It's kind of like you're coming on the back end, giving them the protection that they need with their future health. And, because quite frankly, without health insurance, that can be a catastrophic financial mess, right? So it's super, super important that you have that. And so I'm so glad to hear that, it still kind of keeps you in the realm of health, right? And all of your expertise that you have through the years of being a healthcare provider. I can just imagine how much more you get to bring to the table to help your customers. So that's awesome. So can you explain to the audience, what different types, if there are different types of Medicare that you sell?
There are quite a few types of Medicare. Probably heard of some of them, right? First, we have the Medicare A, Medicare B, Medicare C, and D. And to be completely honest, I call this alphabet soup because there are actually plans A through N. Most of those we don't use, right? But there are multiple types of Medicare. So when you sign up for Medicare, right, the first one you get is Part A. That's your hospital insurance, right? So that's when you get admitted to the hospital, you stay overnight. Then there's Part B, and Part B is the one that covers your outpatient visits, right? You go to the doctor for a checkup. You want to go get an imaging study that covers your mental health service and your lab work. One of the other optional programs that people get is Medicare Part C. That's your Medicare Advantage program, right? So that plan is actually offered by your private insurance companies, and that combines A and B. And then a lot of those plans offer vision and dental and sometimes prescription drug coverage, right? So your normal Part A and B Medicare do not have your vision and dental. And that's something you want to pay attention to because that's still an important health need.
Just those four ABCD is enough to know, thank God you're here.
Yeah, and Part D is your prescription drug coverage. And that's not even all of them. You know, to be honest, I've been in healthcare a long time, and, you know, I had to really work hard to learn all of this information because it is complicated.
Not only that, but it's always changing, right?
Every single year.
Yeah. So how much continuing education do you have to do to prepare for the next year and, you know, all the changes that might be coming down the pipe?
Yeah, absolutely. So in order to be a healthcare agent, you actually have to take an online course called AHIP. Basically, it is a Medicare fraud, waste, and abuse program, right? Because the government wants to protect against Medicare fraud, and then they want to teach you about the Medicare changes. So that can take, 6 to 12 hours depending. And then each insurance carrier that you are contracted with requires their own education. So not only do you do the mandatory Medicare and the fraud, waste, and abuse, but each insurance carrier has some training, and they each took me 45 minutes to 3 hours, depending on the carrier.
Gotcha. So as you were explaining A, B, C, and D, A, I believe, is that given to everybody?
Yes.
For free?
So most people get Medicare Part A for free. And I say free in quotes because we all pay Medicare insurance if we worked, right? But Medicare A is free for those of us who have worked 40 quarters. So that equates to 10 years of work. Now, that can also be a spouse. So you or your spouse, worked that 40 quarters. And if you work that 40 quarters, then your Medicare Part A is free. If not, you may have the option to purchase it. And those numbers change yearly as well.
Wow. Awesome. So is there something such as like supplement to Medicare? And if so, is that something you provide for your customers as well?
Yeah, so there actually are Medicare supplement plans, absolutely wonderful plans. They can be a huge help for those who expect to have very high healthcare costs, right? Medicare supplement plans cover a lot of your healthcare costs without those copays and coinsurance and some of those large deductibles. So they're a great plan, but they're pricey. So they cost people a lot of money per month. And you can't enroll in them at any time. So when you're first turning 65, that's when you want to make that educated decision if you think you need to purchase the insurance that costs more monthly, because you don't always have an option to change as easily later on.
Yes. So as a financial coach, this topic comes up pretty frequently. And as someone who is wanting to maximize and organize their budget so that they can have margin if they're still paying down debt at that point in their lives, hopefully not, but some are. That is something that I would like to know, based on the supplemental premiums versus, is it really saving them yearly based on the need of healthcare prescriptions or so forth? You know what I mean? So I like to know those, like, do you help them walk through that process to make sure that it's financially feasible and a good ROI?
Yeah, absolutely. So it becomes a little bit complicated. So, one of the first things we look at when we're looking to get a med sup plan is your healthcare needs, right? So if you are a super healthy 65-year-old, probably not getting a lot of medical care, right? You may not want to purchase that Medicare supplement plan. But say you're age 65 and you had some sort of a cancer, God forbid, or a heart problem, or you're on an expensive medication, that might be a good reason to consider the med sup plan because you would save money in the long run. I think the other part to look at is, are you eligible for financial assistance from the hospital system? So most hospital systems have financial assistance programs, and depending on your income, and their income levels are actually rather generous, you may qualify for some assistance with your copays and coinsurance. So that's something a lot of people don't know, but it can be a huge help.
Do you pass that along to them to kind of, I mean, because knowledge is power, right? So if you equip your customers or potential customers with the knowledge, it gives them the ability to be proactive in how they want to handle their healthcare moving forward.
Yeah, absolutely. So the thing about healthcare is prevention is key, right? And treating what we have is key. And, some of these medications that people require are expensive, right? Now, those of you listening, you might recognize a few names, but like we're talking Eliquis sometimes, Jardiance, Entresto. Some of those meds are really expensive and they really help patients, but my patients don't always have the means to afford them easily. So these are ways to help.
Yeah, a matter of fact, this was brought up this last week here with a client of mine, and the conversation regarding a copay for one of those expensive prescriptions. And one way to manage and free up some funds is if you buy like ahead, right? So you can buy maybe 3 months worth of your medicine and save on the copays.
Yeah, absolutely. So, medication can be expensive, right? And regardless, you're going to have a Part D deductible, okay? So the Part D, remember, that's your prescriptions. And typically you got to pay about $615 before Medicare starts to cover your prescriptions, okay?
Wow.
Most plans. Sometimes you can buy an extra plan, and that extra plan might have a lower deductible, but those cost more money. One important thing to note is the max out-of-pocket you can pay for 2026 is projected to be $2,100 for your medications. Now, 2 years ago, that used to be $7,000, so we're better, but still could expect to pay up to $2,100. To save money on your prescriptions, there's a couple of things you can do. First, if something is expensive, let your doctor know, right? Maybe there's an alternative that's cheaper. Number two is, see if they'll write you a 3-month prescription. You can often save on the copays if you get 3-month supply, 90 days, instead of the, 1-month supply, provided it's an eligible medication. And then you want to make sure that you're, staying in the network, right? Make sure you're going with the pharmacy that your insurance pars with. And then sometimes you can consider mail order. And otherwise, don't be afraid to shop around, right? If your medicine's looking expensive at one pharmacy, you can look at another. It won't always help, but sometimes it does. And if it works for you, then it's worth a shot.
Yeah, so it sounds like there's a bunch of different variables that you could actually pursue to be proactive and try to trim maybe some of the costs on that.
Yeah, absolutely. I mean, every dollar saved is a dollar in your pocket, right? And I'm all for that.
That's right. 100%. Awesome. So are you like independent? Are you an employee? How does this work exactly?
Yeah, absolutely. So I actually work for a company called Prestige Benefits and Insurance. They are based out of Las Vegas. But basically, when my burnout was happening, my uncle is a financial advisor, and I gave him a call and said, hey, listen, I just want to pick your brain. Like, I'm thinking maybe I want to make a move to finance. And he said, Ashley, you can make a move to finance. He goes, but you're really good at healthcare. Why don't you start with just the healthcare insurance part? And that's what I did. So he worked for this company in Las Vegas, and I came on board with them. And I am the first one in the New York market and actually the Pennsylvania market. And that's been really great. I have a great team of mentors, and it has just been an amazing journey so far.
That is super cool. So being the only one in the area. Ooh.
I know. I mean, there are definitely other health insurance agents in the area, right? But I am the one with Prestige Benefits and Insurance.
Super cool. So do you have any limitations as far as who you can serve? So do they have to be New York residents? Can they be Pennsylvania, Rhode Island residents? How does that work?
Yep. So each insurance agent is licensed per the state. So I am licensed in both New York and Pennsylvania. It's not too terribly difficult to get your license in other states, but I primarily like to serve, those around me because I like to meet my people, right? I like to meet the clients I work with and, build a true connection.
That's awesome. Yeah, I think that, something to be mindful of is that a lot of times we have real estate agents, we have life insurance agents, health insurance agents, financial advisors. all sorts of different other professionals to help and provide services, but many of them are landlocked to the licensing state that they're in, right? It's not a free-for-all, and they can help someone in California if they live in New York necessarily. But it sounds like that's pretty common for people to say that it's easy to get licensed in other states if they had a supply and demand type of thing, you know what I mean? Where people were, it's going to be a good ROI for you to invest in getting licensed in another state to serve people from that area.
Yeah, absolutely.
Awesome. I want to piggyback back on the supplemental insurance again. Actually, I had a client ask me this question, and that was, is there anyone who doesn't qualify for supplemental insurance? Because let me tell you the scenario, okay? The scenario is a pension New York State employee, right, has lifetime benefits, constantly gets phone calls about supplemental Medicare, retirement age, right? So they're getting supplemental insurance phone calls. And as soon as they tell them that they were a New York State employee, the call is ended. So what's going on with that?
So that's actually interesting. My mother is also a New York State retiree, but the way New York State works is they actually choose your health insurance plan for you. They choose your Medicare plan and tell you which one you have to enroll in. So they kind of get control over that part. So currently it was a United Healthcare plan, right? But the New York State insurance picks up the cost of that insurance. So they're the ones who get to choose your insurance plan because honestly, because of how well New York State insurance covers after the Medicare, in this patient's case, patient I say, because that's my word, right? Client's case, getting a med sup plan probably wouldn't be their best option in terms of spending all that money, and New York State wouldn't foot that bill.
So even if they wanted to, it didn't even seem like they had the ability to have the conversation. That was what was weird about it.
Yeah, absolutely. Because to be honest, the state isn't going to let them do that because they get to choose the plan.
Gotcha. Okay. I'll be sure to carry over that info. All right. So tell us a little bit about how you get compensated. Do you get paid like on, each contract? Do you get a pay from the company that you work for? How does that work?
Yeah, so it's actually the insurance companies that pay us, right? So any clients that I have, they don't pay a dime for the service. When someone signs up for a plan or we assist them to sign up for a plan, we get reimbursed by the insurance company, and then my company gets a cut of that too.
Is it a one-time thing per person, or does it renew, say, upon renewal of their health insurance?
Yep, so it's a one-time for a new plan. And then on the next year, you get a lesser payment if they continue on the same plan.
Okay, cool. Awesome. I just feel like transparency is really like awesome to, just keep it in the open, right? Therefore, there's no questions, no guessing, no assumptions, all that good stuff. So awesome. Thank you for sharing that. So you already talked about that the continuing education is required. So you were able to sell insurance of January of this year. So fast forward into 2026, what needs to be done on your part to be able to roll into 2026? Is it a certain amount of CEUs like it is as a healthcare provider? Like, how does that work exactly?
Yeah, so when I started in 2025, I did the education that I talked about before for 2025. And then in order to start for the Medicare open enrollment, which starts on October 15th and goes to December 7th, I had to redo all of them. I had to redo the fraud, waste, and abuse training that I had just done, and then I had to redo education for each individual carrier.
What would you say? How long does that take you?
Probably about 16 hours, I'd say.
Okay. Wow. Awesome. What a commitment, right? To be able to continue doing what you do. So now, as a previous healthcare provider myself, Medicare was always the top payer. Is it still true?
Yeah, Medicare is not quite the top payer any longer.
No?
I wish I could say that, but not quite. To be honest, a lot of times your private insurance tends to do the best, but it always varies based on, are you in network, are you out of network, your area, etc. Remember, healthcare is a business, right? Like, whether we realize it or not, healthcare is a business. So, those payments can just vary widely.
Awesome. All right. So how do you help clients? Take us through what it looks like to help clients find a plan that best fits their needs on the medical prescription, financial, restrictions. What's that process look like?
Yeah. So the first thing you want to do is to, as you're starting to compare plans, right? They're different per county. So you kind of go through a system and you look at the plans in the county. And then we want to know each one of your doctors. I want to know every doctor that you see because I put their name in to make sure that they're in the network, right? Mm-hmm. And then I want to know all the medications that you take to make sure that those are covered. So that will help us to, pare down from all the plans to a couple. And then we want to, look at, would you maybe be eligible for the financial assistance stuff, right? And, get you hooked up with that or, get you the number to call for that. That way you could be saving a bit. And then I want to know if you're traveling, because that, if you were one that traveled out of the area, that would change the plan that I would actually recommend for you. And then lastly, if the client's comfortable, I like to know if they have certain chronic conditions because it changes the plan that I would recommend to them because there are additional benefits for people with certain heart problems or diabetes or things like that give some nice extra benefits, which could be helpful.
Great. On average, how long are you spending on the phone with a customer?
It depends on how much we're chatting, right? Mm-hmm. I like to build a rapport with a client, probably about 30 to 45 minutes, depending on the complexity of their health needs, right? You can get a 65-year-old who takes a vitamin a day, or you can have a 65-year-old who takes 12 meds a day, right? And I'm going to dig in with every single one of them.
Yeah, I'm surprised to hear that it's only about 35 minutes on average. I would have guessed you would have said an hour and a half at least. But that's good. You must hone in on your craft and you're good at what you do, so that's great. All right, so we are coming to the end of this little podcast here with Ashley. And I just want to say, I encourage you to keep doing what you're doing because there's definitely a need. People need someone to break this down and help them process because, like I said in the beginning, it can be very overwhelming. But I just wanted to give you an opportunity to say anything that maybe we didn't touch on today that you feel is very important when it comes to doing what you do.
Yeah, absolutely. So, the one thing I want to mention is a bit about the scams to look out for, right? And this, is for the children of my patients too, or clients, right? Because patients is still ingrained in my head. But I want you to know that Medicare is never going to call you and ask you for payment on the phone. They're never going to call and ask you for your Medicare number. They will not show up to your house unannounced. And they're not going to call you and say, hey, we just want to get you a new secure Medicare card. Why don't you give me your Medicare number and I'll send it in the mail? Those things are sketchy. So don't be giving that information out on the phone. If that happens to you, simply hang up. You can call the number on the back of your card and then know that you're talking with your insurance company to see if they had something that's needed. So I just want everyone to be careful because these are ways that people steal your identity, and I don't want that to happen to anybody, right? I want to make sure everybody's safe.
That is a fantastic reminder and care and concern that you have because I see that happen a lot, and people are very vulnerable at that age. So, that's fantastic information. And now just to get to know a little bit more about Ashley on the personal side, we want to give you a random question to end today's podcast, which is, what is one of the coolest things you've ever experienced in life?
Oh, man. All right, let's think this through. I actually went to Kenya in, 2013. I got to go with my church. And I saw an entire different world over there, right? Nobody sits and thinks of going on vacation to Africa, right? Maybe if you're on a safari, but I went to the poorest areas on the outside of the main city, Nairobi, and I got to hang with orphans, and I got to see home churches, and I watched, zebras and giraffes and baboons walk around, and I saw things that I never would have seen, but I experienced a culture of need that I didn't even know existed. And that probably tops it, to be honest.
Wow. That sounds incredible. I've never gone to a place like that, but I know I love seeing raw, authentic life that's outside of where we get to live. We are very blessed here. A lot of times I say we have first world problems.
Yeah, you're totally right. And honestly, for a while when I came back, it took me a while to reassimilate because it was just so different. The need was so different, and it changed my world.
Wow, that's great. Thanks for sharing that. So just for all of our listeners, what's the best way that someone who is in need can get a hold of you?
Yeah, absolutely. So we're actually going to be having a couple events coming up, right? We got October 13th. We have a luncheon in Newark Valley, and then we're going to have a dinner on October 29th. You can absolutely email me at Ashley, ASHLEY, at prestigebandi.com. And you could also, text me or call me. I'll put my cell phone number right out there for you, but it is 607-206-0596. Please don't be afraid to leave me a message. If I'm working during the day, I promise I will get back to you.
Thank you so much, Ashley.